Comparing prices for healthcare services can be time-consuming and frustrating, but it's easier than it used to be if you know where and how to look. Common tests and procedures like ultrasounds, MRIs, and arthroscopic surgeries that can be scheduled in advance are the most shoppable. Start by asking your doctor if the service being ordered needs to be a specific kind and get the exact CPT code. CPT stands for Current Procedural Terminology and is used for billing purposes by all providers. Make sure you understand why the test or procedure is being ordered, which can affect the cost. A colonoscopy, for example, could cost an insured patient anywhere from nothing to upwards of $10,000 or more out of pocket, depending on whether it's considered screening or diagnostic, where it's performed, and whether the facility and the physician are in-network or not. Most insurers now have online tools that let plan members see how their out-of-pocket costs might vary for the same service at different in-network providers. For example, a search for a pelvic ultrasound on a provider's cost estimator brought up nearly 70 facilities within a 5-mile radius of New York City, with out-of-pocket costs ranging from $9 to $94 depending on the rates insurance has agreed to pay, as well as the member's deductible. Some insurers' tools are cumbersome or spotty, and most caution that the amounts listed are just estimates that could change without notice. Be sure to check that any provider is still in your health plan's network. The insurer's list may be out of date, and out-of-network bills could send your financial costs soaring. Consumers seeking to compare cash prices for medical services can also turn to a growing number of websites for help. These websites generally operate the same way as insurance companies' sites for comparing prices. They are estimates and sometimes based on all information averaged together for a specific area of the country or a larger metropolitan area such as New Orleans. People should remember that these averages are sometimes best guesses based on the data they have on hand, so DIS always recommends doing the legwork and contacting actual providers in order to shop and compare. Standalone imaging centers such as Diagnostic Imaging Services, as well as outpatient surgery centers and urgent care clinics, are generally much less expensive than hospitals and offer lower cash rates to patients who pay at the time of service. At DIS, we will look up your coverage so you can compare the cash price we're offering to the out-of-pocket amount you would owe using your insurance. Hospitals also offer self-pay rates, though their policies vary widely. Some offer cash payers the Medicare rate. Others offer discounts of 20% to upwards of 80% off their charges. But that generally means that their sky-high charge master rates, the often highly inflated list prices that providers set before any insurance negotiations have begun. Think of the charge master as a manufacturer's suggested retail price you might see for a new car or a brand new piece of furniture. It's set artificially high, with the actual selling price being much lower to show savings, when in reality there is no saving to be had. Remember, an order from your medical provider for a test, such as an MRI, CT, or ultrasound, is a prescription, the same thing as what you get for a medication that is filled at a pharmacy. With that prescription, you have the ability to select where to go for services. DIS also cautions consumers to be sure they are comparing apples to apples when they are price shopping. For example, with an MRI, is the radiologist's report included with the scan, or is it billed separately? Am I getting the correct price for the CPT code, as I know this test includes the use of a contrast dye? Assessing how providers compare in quality is also important, although that information can be just as difficult to find. But now that prices are coming out of the shadows, people want to know, is that $4,000 MRI at the hospital so much better than the $1,250 MRI at DIS? The answer is no. Hospitals have no special voodoo they do. The same test, the same results to the doctor, less cost. In fact, in many cases, the technology offered by DIS is as good, if not better, than area hospitals. The bottom line, no sacrifice in quality for cost when you choose Diagnostic Imaging Services. Thanks for watching, and say yes and spend less at DIS.